Stockton heard the fear on the phone.
And my little brother called my mom, and then he called me, and he said, "Can you please come up here? Something's wrong with Granny."
Granny, the family matriarch, couldn't talk, couldn't answer a question.
I remember asking her, "Granny, do you know what today is? Can you tell me your name? Can you smile? Can you do anything, that show us that you're okay?" And she was just she was out of her head.
75-year-old Lottie Crouch was having a stroke in rural Tennessee. Their dilemma, 2 months earlier, the county hospital in Jamestown closed. The closest one in the state, now a 45-minute drive.
I just knew this could be the last time I see my grandmother alive. This could be it.
That same fear strikes hundreds of thousands of Americans across the country. Around 800,000 people suffer strokes every year, many in rural areas, far away from the specialized care they need quickly. Strokes cut off blood flow to part of the brain. The sooner that blood flow is restored, the more the brain can heal.
Minutes can make a difference between whether or not you walk out of a hospital basically ready to get back to your prior self, or whether you have to go through rehabilitation, and whether you can even regain all the functional abilities that you had before.
Along with our partners at Kaiser Health News, we mapped out stroke centers and analyzed how long it takes residents to reach that important care. Our findings reveal nearly a third of people who live in the Delta region live more than a 45-minute drive from a certified stroke center. The places with the long drive shown here in bright red. Some areas have particularly limited access. 42% of all residents in Arkansas live more than 45 minutes away from one of those centers. In Mississippi, more than 30% of residents have at least that long of a drive. In Louisiana, nearly 20%.
But now we're at a point where we're starting to see whole areas of states lose access to care. And so for strokes and other things where you need care really quickly, that can be really crucial.
You believe people in rural areas are dying or having worse outcomes because of a lack of access?
Absolutely. Across the country. From stroke, from heart attack, pregnancy outcomes.
For people in rural areas, think of this like a puzzle. The pieces have to fall perfectly in place for patients to survive.
EMS and fire, I got into it as a plan B, turned into plan A. At the end of the day, it's still somebody's life that could be impacted pretty greatly. So, nerves do set in with that thought.
Adam Green is a firefighter paramedic in Sumter County, Alabama. The nerves come because the pieces to that puzzle sometimes don't fit into place. For rural stroke victims, many need to discover symptoms early, find a paramedic who can quickly arrive, and drive or fly them to a hospital for initial diagnosis and treatment. Green says ideally all of this happens in 60 minutes or less.
Our closest stroke center, 30 minutes away. That's half our timeline eaten up right there.
Across the 13 states in the Delta and Appalachian regions, strokes are a major health concern. Here, the darker the purple, the higher the stroke death rate. We found more than 80% of the counties in these regions have rates above the national average. Washington University's Dr. Karen Joint-Maddox says there are a number of factors in these regions that lead to higher death rates, including overall health indicators such as diabetes and access to preventive and emergency care.
We can't put a trauma center in every corner. That's not economically feasible. But we can have systems in place so that when there is something that happens, be it a stroke or a heart attack or trauma, that we know how to get people the best care that we can. And we shouldn't be leaving it to chance. And right now, unfortunately, in lots of areas, it gets very much left to chance.
And she says in many areas there aren't strong enough links between large hospitals with specialized care and smaller hospitals that are often the first stop in an emergency.
And so it depends on both the rural hospitals knowing the system, and then the urban hospitals or suburban or whatever, the bigger hospitals, having a very clear protocol in place to take those patients as quickly as possible too.
Fortunately, the puzzle pieces fit together for Lottie Crouch.
I couldn't see, couldn't talk, don't remember seeing nothing.
An ambulance took her to a helicopter, which rushed her to Knoxville, Tennessee for treatment.
What could it have been if it had been inclement weather? What could it have been if our 3 ambulance trucks were on another call? How lucky was she, and how many people are going to get that lucky in the future.
And while her family says they had luck on their side, they worry for their neighbors and how those pieces will fit together for the next family.
And I thought, how many people has this affected? How many families like us that it was too late for? How many families before something is done to prevent this from happening?